Well, it's time for our Africa Health Report. Joining us now is health correspondent Linord Moudou with emergency assistance pleas for the Central African Republic and a major health warning for the western U.S. state. Hello, Linord.
Hello, Vincent. U.S. doctors are warning of an emerging polio-like disease in California where up to 20 people, mostly in children, have been infected in the past 18 months. Analysis of 5 cases showed enterovirus 68, which is related to poliovirus, may be to blame. The children in those cases had been vaccinated against polio. Symptoms have ranged from restricted movement in one limb to severe weakness in both legs and arms. Doctors say they do not expect an epidemic of the polio-like virus and that the infection remains rare. And the World Health Organization says 2.5 million people are in need of emergency assistance in the Central African Republic. The United Nations says due to the ongoing conflict in CAR, hundreds of thousands of people are displaced across the country and the humanitarian situation is worsening. Observers say the loss of agricultural lands, food shortages, and lack of access to basic services means that thousands of children are expected to suffer from severe and moderate acute malnutrition.
Malnutrition will be a great concern because of all the crises that we went through here in Boer. People were displaced. Due to this displacement, some kids will not have the treatment for malnutrition and they will become sicker than they were before.
We've been using the mobile team approach since we resumed operations in late June, and the whole idea is to get people on the ground who can basically validate the kind of immediate actions that need to be taken. So we've used this approach to reopen health facilities, to see to the resumption of water services, support to hospitals, and also to identify children that require special protection.
And at least 2,000 people have been killed and some 700,000 have been displaced since December. The United Nations is laying the groundwork for initiatives that will help improve the lives of some of the world's most vulnerable people after its 15-year plan called Millennium Development Goals ends in 2015. The goals aim to cut world poverty, illiteracy, disease, and hunger. VOA's Pam Dawkins updates us.
Some of the children at this Uganda medical center have been treated for severe malnutrition. Their mothers are then educated about good nutrition practices.
I used to feed my baby late and wait for her to cry, but now I make sure to feed her on time.
Programs such as this one, backed by the United Nations Children's Fund, are part of a broader effort to combat effects of child undernutrition, a component of the Millennium Development Goals. At a meeting in Washington, UN, government, and business leaders discuss ways to help communities in developing nations achieve long-term stability. U.S. Presidential Advisor John Podesta said a much better job needs to be done in connecting the poorest of the poor to economic and social resources.
We cannot expect the poor to raise themselves up if they can't open a bank account, if they can't hold or inherit land, if they have no legal identity, or if they're cut off from the crucial infrastructure like schools.
Podesta says poor people need what he calls connectivity.
Connectivity broadly encompasses issues like access to health care, education, and job opportunities, connections to physical, financial, and energy infrastructure, and the opportunity to actively participate in the civic and economic lives of their countries.
But responsive governing is key, according to the head of UN Global Compact, George Kell.
This is the big catalytic thing. If we miss out on this one, I think we miss out on the historic opportunity we have.
It's a broad effort that may help people in communities like this one in Uganda achieve a better way of life. Pam Dawkins, VOA News, Washington.
And that's our Africa 54 Health Report for today.